Hello everyone, and thank you for tuning in. My name is Daniel Tobar, and today we are addressing a topic of paramount importance in healthcare: patient safety, specifically within the demanding field of oral and dental surgery. While most dental procedures are routine, surgical interventions carry inherent risks. Our primary ethical and professional duty is to ensure every procedure is not just effective, but fundamentally safe. This presentation will explore why focusing on patient safety is non-negotiable and detail the key protocols that ensure secure surgical outcomes. Defining patient safety. Why it matters? What exactly is patient safety in this context? It's the minimization of risk and unnecessary harm associated with healthcare. In oral surgery, this goes beyond simple infection control. It encompasses every stage, from the initial consultation and diagnosis to the procedure itself and through post-operative recovery. When we compromise on safety, even in minor ways, the consequences can range from delayed healing and increased pain to serious, life-altering complications such as nerve damage, severe bleeding, or systemic infections. A robust safety culture builds trust, the very foundation of the patient-provider relationship. Key pillars of safety oral dental surgery. Achieving surgical safety is built upon four critical pillars. First, meticulous preoperative assessment and planning. The journey to a safe procedure begins long before the patient is in the chair. This involves a comprehensive review of the patient's medical history, including allergies, current medications, and any underlying systemic conditions like diabetes or heart issues. We must also obtain high-quality radiographic imaging, precisely map the surgical site, identifying critical structures such as the mandibular nerve and the maxillary sinus. Accurate diagnosis prevents catastrophic errors. Number 2, sterilization and infection control. Infection is one of the most common complications. Strict adherence to sterilization protocols is mandatory. This includes the proper autoclaving of all surgical instruments, the use of the sterile drapes and gowns, and rigorous hand hygiene. Maintaining an aseptic field throughout the procedure dramatically reduces the risk of both local and systemic infections, protecting not only the patient but the entire clinic team. Number 3, anesthesia and sedation safety. Many oral surgeries require some form of anesthesia or deep sedation. Patient safety in this area demands constant monitoring of vital signs such as heart rate, blood pressure, oxygen saturation, and respiration by a trained professional, often an anesthesiologist or a certified dental sedation provider. Emergency equipment, including effective airway management kit, must be readily available and checked before every use. Number 4, the surgical team and communication. Surgery is a team sport. Every member, such the surgeon, the assistant, and the anesthesia provider, must be well trained and clearly understand their roles. This includes using surgical safety checklist. It's a concept adapted from the WHO Surgical Safety Checklist to confirm patient identity, procedure, site, and equipment before the first incision. Clear, concise, and professional communication among the team is vital to proactively catch potential problems. Number 5, postoperative care and patient education. Safety doesn't end when the surgery is over. Postoperative care is crucial for healing and complication prevention. Clear instructions. Patients must leave the clinic with easy-to-understand written and verbal instructions regarding pain management, swelling control, like using the packs, dietary restrictions, and oral hygiene. Clear expectations regarding what is normal, like minor bleeding, mild swelling, versus what is complications, like excessive bleeding and severe fever, and that's essential. Pain and medication management. Careful prescribing and patient education regarding prescription pain medication, particularly opioids. It's a significant patient safety issue today. We must adhere to the highest standards of prescribing practices, prioritizing non-narcotic options when appropriate, and clearly communicating the risks and proper usage of all prescribed drugs. Follow-up and availability. An effective follow-up system must be in place. Patients should know exactly who to call and how to reach the clinical team in case of an emergency outside of office hours. Proactive follow-up calls or messages from the clinic staff demonstrate commitment and can catch complications in their early stages. In conclusion, patient safety in oral and dental surgery is a continuous cycle of planning, execution, and review. It requires commitment from every person in the clinic, a culture that values vigilance, and a dedication to lifelong learning. By strictly adhering to established and safety protocols, from meticulous planning to comprehensive post-operative care, we uphold our professional promise to deliver the highest standard of care. Thank you for your time, and remember, safety is always the first priority.